Right, initially what will happen is we will have someone say, oh, somebody has fallen overboard. At that point the mate would say, man overboard, and indicate either port or starboard side, and immediately would assign someone to keep an eye on them. As they are getting that portion done, they would gather their boat hook, they would get their line and their crew vest, they would then come outward, and for instance, they fell over on this side, we would throw that out and into the direction and as close to the person that had fallen overboard as possible. This is designed primarily if the person is able to swim, they're still conscious, and they can start making their way to this and be able to have something that they can use for buoyancy until we can get the boat back around to them. After the life ring has been thrown, they would then don their life vest as such. And at that point, they would be able to grab their boat hook, and while they are moving into position, they will also have someone constantly pointing at the person that has fallen overboard. They'll say starboard side, and the captain running the boat will look to see where they're pointing, and we'll drive the boat in accordance to where they're located. As we make our way to them, there are two different ways we can approach a man overboard situation. If we have caught it quick enough, we can actually back up to them relatively quick, and we can make an effective rescue that way. First part we want to talk about though is it's taken a minute for us to get everything done. It took a minute to realize they had fallen over, so we are now several hundred feet away. So what we would do is we would go up, do a Williamson turn, we would turn back, do a wide turn back onto our former course heading, and head back in that direction. I would be following the line that is being pointed to by the person that has been assigned to keep an eye on. The first mate will extend out their boat hook, and they will move into a position forward, and we will come alongside. At that point they can reach the hook out and either hook them if they are unconscious, or extend it out and they can get a hand onto it, at which point we will stop the boat. They will lead the person down the side, and our recovery portion of the boat is on the stern. You can come all the way around, passing this. You can have someone assist, hold on to it as the mate makes her way back. We have finally gotten them to the back. The chains will be dropped. The engines have been shut down, so we can now safely bring the person around the stern of the boat and to the center portion, at which point we would be able to bend down and recover them. Depending on the mate, if they have the upper body strength to be able to adequately pull the person in, because we never know, they could be anywhere from 30 pounds, they could be 300 pounds. So a mate always has the ability to request additional help from anyone on the boat, preferably somebody who is a first responder, EMT, paramedic, law enforcement, former military, prior military. Doesn't matter, as long as somebody has a little bit of training and can handle an emergency situation, will be just fine. At that point, you bring them up onto the deck, at which point you do your ABCs, airway, breathing, circulation. Tilt their head back, listen, see if you've got a pulse. If you have a pulse and they seem to be conscious, everything is good, then inquire, do you have any injury? Do you have any pain? They're already breathing good, so everything should be good at that point. And if you don't notice any apparent bleeding, then at that point you should be able to return them back onto the deck, and at that point make the decision on whether we continue on or if we come back to the dock or not. If they are unconscious, then at that point we'll determine if they have an airway. If they're breathing but unconscious, then we're immediately assuming that there could be a head injury. We're immediately returning to the dock. We will bring them up onto the back portion, trying to be as easy as we can, trying not to move them around to cause any additional injuries. At that point, return to the dock. Emergency medical people have been notified, so we would be able to get them paramedic back to the dock, hopefully by the time we arrive or shortly thereafter. If they have no pulse and they have no heartbeat, then of course we would start CPR. We do 4 quick initial breaths, at which point we would start compressions. Remember to always go to the bottom of the sternum, 2 fingers up, get above the xiphoid process, hands interlocked, palm of the hand or heel of the hand directly over the center of the chest, directly underneath the shoulders. You want to apply compressions at the rate of about 100 per minute, or at the beat of staying alive. Staying alive. Ooh, 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 ooh. Staying alive. Staying alive. Ooh, 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 ooh. Staying alive. Staying alive. 100 beats per minute. There are 2 different thoughts nowadays as to whether you continue to do any additional breaths. A lot of places now have adapted just compressions only. It's called just hand technique only. A lot of the old timers, we still do a couple of breaths every 15 compressions, every 30 compressions. It depends on if it's a 1-person or 2-person CPR. If at all possible, we will always inquire if we do have any emergency. If we got nurses, RNs, LPNs, whatever, EMTs, paramedics on the boat, and if we do, then of course we will always pick up a little additional aid from medical professionals. So that's good for CPR. How long do you do CPR? Until A, the person either revives, or B, you are no longer able to physically do CPR. Ideal situation, you should be able to hopefully have at least 2, if not 3 people on a boat that can do CPR, at which point you can rotate and you can keep CPR going for enough time, hopefully to get back off the river channel, back to the dock, and have an EMT or somebody standing by when we arrive. The other thing that you always have to be aware of is possible injuries, cuts, or like I say, head injuries, things of that nature. If they have any type of cuts, apparent bleeding, first line is always direct pressure. Take roller gauzes, roller pads, place over the wound and hold direct pressure onto it. Hold it for a bit, check, see if you still have any bleeding, if you still see any seepage, and the gauze has become totally saturated with blood. Take additional gauze, place it over the wound, and at that point do not remove, put more on, back to direct pressure, and at that point you can either tie another roller gauze across, tie a knot directly over top of the wound, and that should suffice for any bleeding. If it's more than just minor bleeding, then either a constricting bandage, or in the event of a severe injury, then of course a tourniquet would be applied.